Good afternoon, and welcome to our Benefits Lunch Break webinar series on January 2021. Happy New Year to everyone. Just before we get started here with today's presentation, a look at the upcoming lunch breaks. Again, these are going to be on the third Monday of every month, or generally that's when we're planning them. Depending on things going on, we'll try to not reshuffle, but I can't promise it. But these are what the dates that they look like they are going to be on for the rest of 2021. So we hopefully you can join us here in the future for these dates as the topics are of interest to you. Additionally, please keep submitting topic ideas. That's very helpful for when we plan these. I know that we got a topic suggestion to do wellness programs again. I think we are going to touch on that. I did that for my first lunch break series webinar back in October. So we're going to hold off on that a little bit. But again, please keep submitting us your topic ideas. And to the extent that we can, we will use those and custom our webinars during this series to those topics. So moving on to today, I am joined by my colleague, Jeff Gray. Jeff, say hi to everyone.
Hello, everyone. Good afternoon. This is a presentation on health and welfare benefits, so it's not really my area, but I'm here to help trip out. And really the only thing that keeps me from being totally dead weight is that I'll be monitoring the questions folder here. So if somebody has a great question, I'll pass that along to you.
Jeff is going to be kind of my color guy so that you guys don't have to listen to me talk for a straight 30 minutes like last month. So hopefully that's a little bit of a break for you guys. But the topic we're going to cover here today is health and welfare benefits under the Biden administration. And what a timely topic that is. It is purely by coincidence, but I understand that just a few minutes ago, President Biden was sworn into office. And so I have to imagine, Jeff, that this is the first health and welfare benefits presentation under the Biden administration anywhere in the country, if not the world.
It has to be, the universe.
I mean, talk about timing, right?
There you go.
Moving on, so get to our typical disclaimer, but this time we have a few more additional disclaimers here. So first, the content in this presentation is our best guess. I mean, we're using information from President Biden's webpage as far as his health policies. And so there's really no guarantees of outcomes here, but we're going to try to explore what we think is going to happen, what the chances are going to happen. And just a warning, this presentation, this is kind of the geeky, nerdy stuff that at least excites me. I don't know about Jeff so much.
Yeah, we goes a little too strong.
So we might run a little past 30 minutes, but if you need to sign off early, certainly don't worry. We post these webinars and slides to our YouTube website. So you can certainly, that'll probably be posted later this afternoon or if not by tomorrow. So feel free to check it out on our YouTube site. Watch it as many times as you like, and feel free to share it with your friends and family, right, Jeff?
That's right.
So what are we going to talk about today? So we're going to go over an overview of President Biden's healthcare plan, specifically, again, with respect to those policies that are likely to impact employer-sponsored plans. We're going to talk about which of those policies are going to require actually legislative changes. So they're going to have to be approved by Congress to implement. And then we'll talk about those policy positions that likely can be done outside of the legislative process, more through the regulatory process by the governing executive agencies. So here's kind of a quick overview of President Biden's healthcare plan. Again, this is from his website as of last Saturday, I believe. And again, these are not all of his policy positions. These are the ones that I interpret as having some impact on employer-sponsored plans. And what I've done is try to divvy them up between those changes or those positions that are going to require some legislative action versus those that just require regulatory action by the Biden administration. So first, course, under legislative, one of the big policy pushes was not abandoning the ACA or going to a Medicare type law, but adding a public option. And a public option is simply, a government-sponsored, government-administered health plan that would be available on the exchange in order to compete with those private-based plans that are offered on the exchange. Next would be eliminating the 400% of federal poverty level income cap on the previous tax credit. Currently, if I am purchasing coverage to the exchange and I'm eligible and I'm hoping to get a premium tax credit to help me pay my premiums, if my income is over 400% of the federal poverty level, I am just no longer eligible for the premium tax credit. And actually, this is kind of one of those sliding thresholds. So 400 is the top. Once I get over that, I'm not eligible for any PTC. But as my income approaches 400%, the amount of PTC that I'm eligible for actually goes down. Closely related would be limiting the cost of coverage to 8.5% of income. So many of you are familiar with what we call these applicable percentages. Often, I get questions, what's the applicable affordability percentage for 2021, Trip? And that is actually 9.83%. But that percentage also applies to what percentage of a participant's or of an individual's household income they're going to have to pay for coverage if they purchase it through the exchange. So again, this year it'd be 9.83%, and it's continually adjusted for cost of living. That would be reset at 8.5%, and it's not entirely clear off of Biden's website whether that 8.5% would then be annually adjusted or if that's just a fixed amount. It appears to be fixed. Next would be calculating the premium tax credit based on the gold level plan. So right now it's on the silver. So when you calculate, your 9.83% of premium using the silver plan, you could of course buy a gold or a platinum plan, but you're going to have to pay more out of pocket. And of course, if you buy a bronze plan, the way it currently goes, you're going to save a little bit more money. So they would change this to calculate those premium tax credits based on the gold level plan, meaning you're really only going to have to pay more if you opt for that platinum level, and you're going to save some money if you purchase a silver or bronze plan. And again, those plans are based on actuarial levels. The silver plan, bronze plan, I believe, pays 60%, and it goes up from there. Another initiative that's been kind of highly talked about, and as you can see, that's some bipartisan support, is stopping surprise billing. And surprise billing is generally when you get those bills that you're not expecting. You go for emergency care into a hospital that's not within your health plan's network, or I think more often you see a provider that you didn't know wasn't in your network. And I think a lot of times that comes up. The examples I hear a lot are pathologists, anesthesiologists, radiologists. You go in for a surgery, you're put under, and it happens to be the anesthesiologist is not in your network. Your plan pays its allowed amount, and then the anesthesiologist sends you a bill for whatever the difference is. Now, interesting enough, the Consolidated Appropriations Act that was passed on December 27th of last year actually had a No Surprises Act. So it looks like this legislative initiative is kind of already in place for the Biden administration, and we'll probably see more regulations on this by July of this year. And then kind of generically, President Biden, when he was running, was a big proponent of not replacing the ACA, but building on it. So there's various positions that would enhance ACA protections. From a regulatory section, we see allowing purchase of prescription drugs from other countries. And interesting enough, the Trump administration already issued a rule to expand the ability of certain entities to do this, but those are really limited to pharmaceutical manufacturers re-importing their own drugs, and potentially would branch off from there, but would probably be limited to pharmaceutical organizations, pharmacies, or possibly state and local governments. It'll be interesting to see if the Biden administration moves that forward moves that even further and allows, in more situations, individuals to obtain prescription drugs from other countries. Next, restore the requirement for most health plans to cover contraceptive items and services without participant cost sharing. So as you know, the ACA generally requires, almost all ACA non-grandfathered plans to cover contraceptive items and services approved by the FDA without any participant cost sharing, which are deductibles, co-payments, co-insurance. But the Trump administration issued regulations that vastly expanded the exemptions to that requirement. And under those regulations, which were upheld by the Supreme Court, essentially, if you're not a government organization, your healthcare plan probably qualifies for an exemption, meaning you don't have to provide those, and participants in your plan will not have access to those excluded contraceptive items or services, which is a little bit different from what we call accommodation, where the employer is not required to provide it. But there's basically an accommodation or an alternative arrangement where participants in the plan will still have access to the required contraceptive items and services. Section 1557, non-discrimination protections, restoring those protections, particularly with respect to sexual orientation and gender identity. Increasing efforts to enforce the Mental Health Parity and Addiction Equity Act. This has actually been a continual push all the way back to the Obama administration and under the Trump administration, and I expect will continue so under the Biden administration. Again, the Consolidated Appropriations Act has a reporting requirement with respect to non-quantitative treatment limitations under the Mental Health Parity and Addiction Equity Act, and that if the DOL comes knocking at your door and says, show me that your non-qualitative treatment limitations for mental health and substance use disorder benefits comply with this law, you have to provide evidence that your plan complies. The DOL is supposed to request this information from at least 20 employers, and that begins here about February 10. We're going to start exploring these provisions in separate webinars in more detail later. And while it's only 20, we will expect the DOL to request this for more employers, but hopefully not too much. I still suspect that if you hear from the DOL this year, you are not incredibly lucky if you're on that short list. And then finally, enhancing ACA protections by repealing certain regulations issued by the Trump administration. All right, so moving on. So I think the biggest question here is how likely are some of these administrative changes? And I think to really address that properly, obviously that's a prediction question, but let's take a stroll through history, shall we, Jeff?
Sounds good.
So let's start with President Obama's first election. So if you think back, the Democrats actually, for a brief period of time, held a supermajority in the Senate, which is 60 members, also called a filibuster-proof majority. And Jeff, do you know why they only held that supermajority from the time period of July 2009 to January 2010?
I have no idea.
I do.
Good.
So actually, if you think back, and this is just some fun knowledge that I stumbled on over the weekend when I was putting this together. So this was the election that Al Franken ran for senator in Minnesota, and it was hotly contested, if you will. In fact, went up to the Minnesota Supreme Court. Once that was all worked out, Al Franken was not sworn into the Senate until July 7th of 2009. And also going on, over on the east side, Ted Kennedy had passed away and his seat was being filled by Paul Kirk. Massachusetts held a special election in January of 2010, of which Scott Brown won that, and therefore the Democrat supermajority, which I guess I should have asterisked that because they technically only had 58 seats. The other two were held by independents, Joe Lieberman and Bernie Sanders, but they did caucus with the Democrats.
Yes, for sure.
But anyway, that just goes to show they also had a majority in the House of 257 to 178, so a pretty comfortable majority there. But this was still, the ACA was still really, really hard to pass. It didn't pass the Senate until December 24, 2009, late at night, like the small, the 60 to 39, they needed every single vote. And they got that last vote. Maybe some of you remember the Cornhusker kickback. That was Senator, I think his name was Ben Nelson from Nebraska. He wouldn't sign on to this until Harry Reid made an exception that said, hey, if Nebraska expands Medicaid under the ACA, the federal government will finance Nebraska's Medicaid for forever, not for just a limited period of time like it would for the other states. That section was actually later repealed when the ACA was amended, but that was what they referred to as the Cornhusker kickback. The ACA then went on, of course, to the House where it passed. There was actually 34 Democrats who voted no in that 212 number, and signed by President Obama on March 23, 2010. So I guess the point here, which I've taken a really long time to get to, is President Obama had a significant majority in the House, super majority for a limited period of time in the Senate, and it still took him 427 days from his inauguration to get his signature healthcare bill passed. So let's compare that to, of course, the Trump administration. So the Trump administration also enjoyed majorities in both sides, both the House and the Senate, but much smaller. In the Senate, he had a 52 to 48 majority, and in the House, a 241 to 194 majority. And as you may remember, Mary Bauman and I held a webinar, much like this. We were sitting in the same room, Jeff, in January of 2017, and we were pretty confident that the ACA was going to be repealed because, in fact, Congress had just passed an ACA repeal bill not too long before that.
I remember that.
But it was vetoed at that time by President Obama. But with such narrow majorities, they had to use a process called reconciliation, which is the budgetary process. And we won't get into the nitty gritty about that, Jeff, but they only need a simple majority in the Senate of 51 votes to pass. So we kept seeing these attempts. The Patient Freedom Act of 2017 introduced into the Senate, made it no further. The Obamacare Replacement Act, again, introduced in the Senate, I think by Senator Rand Paul introduced that. Again, never made it past the introduction stage. Finally, the American Health Care Act was introduced into the House. Originally, I think the Republicans thought that was going to pass, and then they were threatened by the House Freedom Caucus that, they were going to block it because it didn't go far enough. So they tabled that, did some revisions. The revised Americans Health Care Act was reintroduced in the House on May 4, 2017, and passed that day. Went over to the Senate. The Senate introduced the Better Care Reconciliation Act, which was basically the American Health Care Act, renamed with some additional changes. Had that passed, it would have had to gone to a conference committee between the House and Senate to work out the differences, and then been passed both again. Of course, as you may remember, that did not pass the Senate. And then finally, the Republicans' last attempt to repeal the ACA was this pared down or skinny proposal, which really did it was repeal but not replace. And for those of you who remember, this is where the famous Senator John McCain thumbs down came. He was able to make it back after his surgery to Washington and voted against this bill, making it fail 51 to 49. It fell. Hey, Jeff, I kind of enjoy Mitch McConnell's posture in the back. You can tell he's just not happy with his arms.
He'd rather be somewhere else. Yeah.
All right, so let's refocus here on President Biden's and what do we think. So upon President Biden's inauguration, as everybody likely knows, he'll have a 50-50 tie in the Senate, of course, with Vice President Harris being the tie-breaking vote. Did you know that a split Senate, an evenly split Senate, has only happened 3 times before in the past, Jeff?
I did not know that.
You do know that now, right?
I know that now. And for those of us listening who really try to avoid politics as much as humanly possible, although it's hard these days, tell us a little bit more about the 50-50 and how that might play out with certain senators who maybe are a little bit more moderate in certain parties.
Absolutely. So, obviously, again, most bills will require 60, at least 60 votes in the Senate to pass. unless they resort to this reconciliation process that the Republicans used to try to pass the ACA, and in fact actually did pass their Tax Cuts and Jobs Act at the end of 2017. They used that reconciliation process. I guess they could either use reconciliation or they could try to abandon the filibuster. But to abandon the filibuster, they would need a majority to do that. And Senator Joe Manchin has already come out in opposition to that. So I don't think that abandoning the filibuster is on the table right now. So again, it's going to be likely that any major legislative changes from President Biden will have to be passed, through using the reconciliation process, which can be done. But here's the kicker: under the Byrd rule, Jeff, that reconciliation bill can't have any what we call extraneous provisions. And a provision is extraneous if it meets any of these 6 criteria. Mm-hmm. So if it has no budgetary effect, it can't be part of the reconciliation bill. If it worsens the deficit without achieving a reconciliation target, can't be part of the reconciliation bill. If it's outside of the jurisdiction of the relevant congressional committee, so I guess maybe a crazy example would be, if we're talking about ACA enhancement provisions, if they were passed by the Senate Foreign Relations Committee, I think that may be outside of their jurisdiction. Can't be in a reconciliation bill. The budgetary effect is only incidental to the non-budgetary policy change. So we have a policy change that maybe has some budgetary effect, but it's rather minimal compared to what the policy change actually is. Sure. It increases the deficits beyond the 10-year budgetary window. And then Social Security changes are also off the table. Now, interestingly enough, it is the Senate parliamentarian who decides whether a provision is extraneous or not. And I'm not sure that position has been picked yet. If it has for this session of Congress, I'm not sure who it is. But there is some commentary out there that says that the president of the Senate, which is the vice president of the United States, Vice President Harris, can actually overturn the parliamentarians' decisions of it. So it'll be interesting to see what happens if any of this legislation is tried to push through being used through reconciliation. So I guess to go back to the initial question, Jeff, how likely do we see these legislative changes happening? Probably not good unless we use reconciliation. And if we use reconciliation, under the Byrd rule, I would say the public option off the table. You can't get that through. Most of the ACA enhancements probably off the table. I guess if maybe you can make an argument that they have some budgetary effect, they could be included. Having said that, these other issues probably are still possible using the reconciliation bill because they do impact the federal budget, specifically expenditures during the year. And again, that would be removing the 400% income cap on the premium tax credit, limiting premiums for marketplace plans to 8.5% of income, and calculating the premium tax credit based on the gold plan. I still think that you're going to have to be optimistic to think that even these get through on a reconciliation bill, at least this year, because I've also heard some chatter, Jeff, I don't know if you have, that Biden's biggest push right now legislatively will be his 1.9 trillion, I should say, not million, trillion coronavirus stimulus bill. And my understanding is if that has any success, also likely going to have to be included as part of the reconciliation bill. So I'm not so sure we're going to see any of these changes at all. Certainly, probably not in the first year of President Biden's president. That's just my guess.
Outside the public option, do you see any of these enhancements? I mean, if the Biden administration sort of gets its wish lists on these items, do you see that impacting employers continuing to offer health insurance plans, or really not at all?
I don't think it. I mean, it depends on what you mean by impact. Will it impact their health plans that they offer? Absolutely.
Sure.
Without a doubt. How significantly remains to be said. I don't think any of these options, any of these changes are going to be the straw that breaks the proverbial camel's back, and employers finally say, I'm getting out of the healthcare business. Right. I'm terminating my healthcare plan. I don't see any of that.
That's kind of what I was getting at.
Yeah. I mean, if you think back to when they had the Democratic primaries, when some primary candidates were pushing for the Medicare for all or the, single payer system. Yeah. A lot of those provisions were going to theoretically make private employer plans, they would say illegal. I'm not sure if illegal is the right term. I don't know if you would have gone to jail, but impermissible, not compliant, subject to many civil penalties. That was not President Biden's position. Again, his position was more strengthening ACA, offer the public option alongside with private option. So again, even if the Biden administration got its wish list, I don't think that is going to impact and cause employers to throw up their hands and say, that's it, I'm finally out.
That makes sense.
All right. Moving along, we'll talk about some potential regulatory changes. And really there's two ways for the Biden administration to do this. One is clearly issue new regulations. And of course, the other one is to repeal regulations issued by the Trump administration. But of course, that is easier said than done, right, Jeff?
That's right.
So what comes down to it when they're issuing new regulations? Well, if you want to be quick about it, the Biden administration can issue executive orders, which I'm hearing there's a whole slew that are going to be signed today, but I think those are more environmental and immigration related than they are impacting health policy or employer-sponsored or healthcare plans. But you could also do it through sub-regulatory guidance. Just a couple caveats. EOs do have the force of law, I guess to the extent that they're not unconstitutional, but they are generally drafted and they more or less direct an executive agency to go ahead and issue regulations. If you think back to some of Trump's regulations, it was like, find ways to make the ACA less of a burden on employers and providers.
I'm sort of frustrated by those because I don't think those ever panned out, right? There was one that specifically said the DOL and the IRS to figure out ways to simplify all these disclosures. And the DOL kind of came out with this electronic disclosure rule, but didn't
only for retirement plans, though.
Right, only for retirement plans, and it's sort of like here you can put them on the internet now, but it certainly didn't simplify the content of them at all, which I think was part of the direction in that executive order. So it seems like these agencies sometimes can kind of read these executive orders the way they want to.
Correct, and obviously there's some career level bureaucrats that even as administration change, their priorities may stay the same. Yeah. But if you think back, that's kind of where the generation of the short-term health insurance plan, association health plans, or AHIPs as we call them, ICRAs, individual coverage HRAs, that was the genesis of all those. But those were directions that came kind of broadly from the Trump administration, and then the relevant executive agencies issued guidance or regulations to implement that. Then we have sub-regulatory guidance. Now that doesn't really have the force of law, but what it does is it helps us kind of interpret where the executive agency's head is at, if you will, how they're interpreting certain laws or regulations. And of course, as an executive agency may change their interpretation, that may have to change our interpretation of it as well, which may change the position on one item or another. Now, if they actually are going to implement some of these policy positions through regulations, they would have to go through, the actual, they have to draft the regulations, which usually comes after some request, public request for comment. They issue some type of either notice of proposed rulemaking or proposed rulemaking. Those proposed rules have to sit out in the public for a while, generally at least 60 days, if not longer, of which point the public can submit comments on it. And then generally, depending on, how juicy the issue is will depend on how many comments they get back. Sometimes it can be in the thousands. And they go through those regulations and determine whether they need to make any adjustments before they issue final regulations. Once they do that, issue final regulations that generally has some perspective, effective date. But I guess it just goes to show that this can take months, if not years, to complete from start to finish.
Aren't the cafeteria plan regulations still proposed?
Yes, great point, Jeff. I didn't even think about that. So the Section 125 proposed regulations that apply to cafeteria plans issued in proposed form in 2007.
It's been a while.
So they are now 13 years old. In a couple of years, they'll be old enough to drive.
Right.
So yes, they can take a long period of time. Obviously, the other way that they can accomplish some policy projections, for example, would be, restoring the the plans that have to cover contraceptive items or services on a first dollar basis is by repealing Trump administration regulations. And really how you do that is going to depend on where the regulation is kind of in the regulation process. So the regulations have not been sent to the Federal Register yet. The executive agencies are going to hit the pause button. They're not going to send them to the Federal Register for publication, and probably they're going to be abandoned. And even if it's an issue that the Biden administration is interested in issuing regulations are, my guess is they're more likely to start fresh than they are off the current ones that are sitting there. If the regulations have been published in the Federal Register, but they're not yet effective, the administration can pause them for up to 60 days. And I suspect any regulation that was issued but not yet effective will likely be paused. Maybe a good example of that, best interest DOL regulations, are those published yet?
I don't know if I don't know. Sorry.
I give you one time to shine, Jeff.
I know.
Put you on the spot.
That's my fault. I don't know that they've actually been sent to the Federal Register.
Just a nuance here. Proposed regulations. So yeah, while they'll be paused, it could be the Biden administration, like the proposed Section 125 regulations, just never finalized. And it's our understanding that executive agencies may still enforce proposed regulations, but we understand that if it ever gets into the Department of Justice's purview, they will not attempt to enforce proposed regulations. Then after that 60-day pause, again, for final regulations, if we want to repeal them or revise them, we have to do that through the formal notice and comment rulemaking method, which takes a while. Next up, we have one more bite at the apple to go after regulations that have been already issued. It's the Congressional Review Act, passed in 1996 after the legislative veto was found unconstitutional by the Supreme Court. Do you know that, Jeff?
I did not.
The CRA allows Congress to review and repeal regulations issued during the last 60 legislative days, not 60 days, legislative days. And by a simple majority of both a vote in both the House and Senate, they can repeal those regulations without any consent by the Biden administration. Now, one thing to note, again, is it's legislative days. I understand that calculation is a little bit hard to make, but what this looks like is any regulations issued after August 21, 2020 could potentially be repealed using the CRA. Now, the CRA does have a couple of drawbacks, and that's you have to repeal the entire regulation. You can't do it bit by bit. So, if you think about a regulation as issued as quite broad, there may be parts in there that the Biden administration likes. Yeah. But if they decide to repeal it, it all falls. You can't do it, piece by piece or line item, if you will.
Yeah, we had those final regulations on fiduciary responsibilities with investments for retirement plans with respect to environmental and social ESG, social and corporate governance items. I think the Biden administration is probably not in favor of that.
Because those put substantial limitations on a plan sponsor's ability to invest.
That's correct.
Retirement funds in those ESG funds, correct?
That's right. So probably not something that the Biden administration is in favor of, but I'm sure that the Biden administration would want to have its own take on those rules. So I wonder, I sort of doubt that's something that they would want to completely repeal if they're prevented from adopting something similar in the future.
And that's kind of what leads me into the second bullet here is the other drawback is if you repeal it, then forever into the future, that administrative agency is prohibited from issuing a future regulation that's substantially the same. It's kind of barred. And the problem is nobody really knows what substantially the same is. It's not defined in the Congressional Review Act. And until 2017, the Congressional Review Act was only used one time. It was in 2001. I think it had to do with some environmental regulation issued by by President in the Clinton administration, actually. So it has, I guess the point is it hasn't been litigated. So we don't really know what the extent is of the substantially same, but if Biden, using Jeff's example, if Biden wants to reissue regulations on these environmental, social, and what's the
corporate governance,
investing, he may be tentative to use the Congressional Review Act on the possibility that could bar him from ever future issuing regulations on the same subject. So of the regulatory changes, what do we expect the regulatory changes? Again, of the regulatory changes, probably the only one that can be done using sub-regulatory guidance is the increased enforcement of the Mental Health Parity and Addiction Equity Act. Again, we've seen a pretty consistent position on that from all the way back to the Obama administration. But that doesn't mean the executive agencies, again, won't use sub-regulatory guidance to clarify other positions and potentially even change, I guess, an agency's position on a certain issue. So what regulations do we likely think will be repealed or substantially revised under the formal notice and comment rulemaking period? These are just examples. Again, the contraceptive mandate, association health plans, the Section 1557 non-discrimination provisions, again, particularly those that deal with sexual orientation and gender identity. Some new regulations that were just issued, Jeff, that will allow HRAs to be used by employers for direct healthcare arrangements. IRS issued proposed regulations, I think, late last spring on that, and we were expecting some final ones here pretty soon, but those could easily be pulled back and repealed. Foreign RX importation, I think maybe those rules could be repealed or at least revised to broaden them. Again, short-term health insurance plans, which really you can have for 3 years now and then renew them, probably be shortened back down to 3 months. Grandfathered health plans, recently IRS issued some additional regulations that allow employers potentially the ability to increase fixed dollar cost payments in greater amounts than what they previously could do and still maintain grandfathered health plan status. EEOC wellness program rules under the ADA and GINA. So for those of you that joined us for our first webinar series, this is what we talked about, but my presentation was based purely on an EEOC transcript. They actually got these regulations out at the very beginning of this month, and we will be doing some webinars on that in the future. But just like the EEOC's whiffed the first time they tried to get these out, this could be strike number 2. The HIPAA privacy rule related to coordinated care and individual engagement. Now, having said that, I think the policy positions are something which could have bipartisan support. And a little highlight or preview. This is likely going to require, if these actually go through, some amendments or some changes to HIPAA policies and procedures maintained by employer sponsors of particularly self-funded group health plans, but more on that later. And then other ACA enhancements. You'll see that I did put some asterisks on some of those items. Those are the items that appear that the Biden administration could repeal using the Congressional Review Act. But again, I think that's probably only likely as a nuclear option because of some of the drawbacks that we discussed. All right, Jeff, it looks like we still have like 57 people with us, even though we went almost 15 minutes long.
That's great.
We don't have any questions.
We don't have any questions unless there's something wrong with the technology here. But
I think that's means something wrong with the technology user.
That could be. That could very well be. But I'm touching the screen and moving things around and nothing's popping up. So I don't think we have any questions that have come in. I don't really have any. You answered my broad question earlier today. So I don't have any additional questions either. I think you covered a lot.
All right. Well, let me thank everyone for joining us today. Please join us again the third Wednesday of next month. We haven't developed a topic yet. We're going to try to push topics, beforehand so you guys can decide whether it's a issue that you want to attend. And again, we always put these on YouTube, and the PowerPoints are available. I think the PowerPoints you may have to give us a call or contact us to get, but the video will be on our firm's YouTube page. Until next month, we'll talk to you later. Thank you.
Thank you.